A very good morning to you guys. Welcome to Asake Online. This is the Breakfast Club. We're coming live from the Bulawayo Amara, where we're doing International Condom Day, and also there are different stakeholders giving different services, talking about encouraging young people to use condoms and celebrate International Condom Day right here in Bulawayo. Hope you guys enjoy the services that are offered here. They are doing HIV testing, STI testing, family planning, counseling, and many other services. Hope you guys enjoy the show.
It's always a special regarding people. Yes. Aliphela lithuthukile kodwa alipheli bona angeke uzothola ikhondom hayi ngena kudansela phuma kuphezulu never likhaya ligqonyiwe kuphela lalela wena isemaphepha satshiyeneyo wena sile strawberry hayi wena strawberry azizela ikhondom ngazi usithenge sile banana sile chocolate yeyi wena ngasakuzela ngoba ikhondom sibe ngeCarex bakini yeyi wena usekile so iCarex hayi wena usekile so iAHF Commemorations abangalisayo lapha thethela ngapha akuphathele into ezimnandi into ezinhle la ungasuka phela ulolu wasemangalisayo njalo usuke njalo ule kufakaza ukuthi ngempela lapha ama-organization seni uyenza international cancer international mama neshizomada boti awuzikubona ithembela kweligreen ngani imengo engavuthwanga. Alright, it's National AIDS Council bakithi. Siphethe AHF Healthcare Foundation. Ayiba babona into zekubona HIV and AIDS labo. Siphethe Million Memorial Project Zimbabwe. Ngabantu abatho ukukhuluma la ngento ezemalana nge-HIV and AIDS yasontela. Yebo. Phela thina bayamathi silentoni. Sile pressure futhi sile session yenza ngani session. Isession namhlanje iphakamisele njengoba ibona ke bagqokile ngento zabezinhle. Usonyiwe hata kulilwa.
Let's talk about the date of February. How did you arrive at this date at Commemorate Condom Day?
Okay, thank you very much. I would give a bit of background to say the International Condom Day is actually a brainchild of AIDS Healthcare Foundation. This is a global, organization that is actually based in the States. So how we, as an organization, arrived at the 13th of February. I'm sure you are all aware that the 14th of February is a Valentine's Day, and people would want to express love to their loved ones in different ways. One of the ways being sexual activities. So we are saying that for us to prevent new HIV infections, we actually need to make condoms available prior to this Valentine's Day, as people would be expressing love, as I said, to their loved ones in different ways. So this is actually in preparation to get into the Valentine's Day. So we are saying people should get to commemorate or to observe the Valentine's Day well equipped with their condoms, and should they feel to really engage or indulge in sexual activities, at least that will be safe sex. So that's why we actually decided to settle for the 13th of February. And there's also one interesting question that you have asked me to say the Vuzu, parties, especially here in Bulawayo. So we are saying, we know that our young people would target the Valentine's Day to organize some vuzu parties, and therefore we want to make the condoms available before this vuzu party spree, which is likely to happen tomorrow, the 14th of February. In terms of ending vuzu parties, I think it's really an uphill task that we have as a country to say how do we stop them. We have done quite a number of interventions as an organization, but also in coordination or in collaboration with the National AIDS Council, where we were trying to disseminate information through billboards. We have also conducted some anti-vuzu marches right here in Bulawayo in the city, and we have also conducted some TV shows to discuss really with the young people as to how to end vuzu parties. And I'm glad that it's also now related to the issue of drugs that is quite rampant, and our government has actually set up a task force to look into those things, and we are working together with the task force to come up with the strategies as to how we can end or at least reduce the frequency of the vuzu parties. But I may also want to let you know of something that we have done which is quite interesting. We have actually conducted a research into the vuzu parties, how it happens, what are the key drivers, and so on and so forth. And we have actually done some dissemination workshops, to try and really have people understand, programmers particularly, understand how the phenomenon of vuzu parties is going on. And we have strong recommendations that we are trying to implement so that we end the vuzu parties. And one of such interventions is actually to establish entertainment centers here in Bulawayo particularly, because people engage in vuzu parties because they lack entertainment. But we are saying, as a way of addressing that, we need to come up with entertaining activities for our young people. And we are also emphasizing on positive parenting, because we want parents to really monitor and ensure that all the activities that their children do, they are aware of.
Yeah, let's speak about the 95 by 95 by 95 campaign. How far are we as Zimbabwe in terms of reaching that goal?
Okay, perhaps on that particular one, I may generally comment, because I'm sure officials from the Ministry of Health would actually give you details, adequate details as to what really has been prepared. But as a programmer within HIV and AIDS, I think we have done quite well. In those 90 strategies. In fact, we are now pushing for the 95-95, because we have actually done quite well, for the past targets of 90-90-90. So our effort now is really, to attain 95-95, of which some of those targets we have attained. But as I said, I think officials from the Ministry of Health can actually get into details in commenting on that particular one, to say where are we as a country and what are the challenges that are there.
Okay, Ibizulami Esnatsbanda from SEWAT. We are an organization that nurtures young people to be advocates and they take care of their health, because at the end of the day we want generations of healthy young people. So this day is very important to us as it fits into our vision, because we understand that condoms offer dual protection. They protect people and young people specific on HIV and AIDS, STIs, and also unwanted pregnancies. We have seen in media, we work in media, where there are high cases of abortion, there are high cases of STIs among us young people. So this day becomes very important to us, because we use it as a platform and also as a vehicle to advance issues to do with advocacy, awareness raising around protection, and also educating young people around safer sex practices, and also just in healthy, because at the end of the day we want a country which has young people who are driving the economy and everything, who are healthy. We can't have a bigger chunk of the budget going into health issues, trying to address inking as always test. So as we commemorate this day, we encourage young people to condomize. Our message today is condomize, don't compromise. And the 2024 theme is always fashion. Condoms, they are there for us and we need to use them.
Yeah. So what service can you offer today? What service that are offered here today?
Okay, so what we approach everything with a non-clinical perspective. So we mainly focus on social behavior change communication. So we give out information accurate and as it happens, and you also refer to other services. So right now, as you can see, everyone here, they're offering HIV testing services, STI screening, and a whole lot of other activities that has an impact in terms of reducing HIV and AIDS. At the end of the day, we are saying we need to close the tap. We need to reach a point whereby we no longer have new infections. Those who are already HIV positive, they've suppressed their virus, and all the other targets that we have, and we're advancing as a country.
What can you say lastly to young people about this day and the importance of using condoms?
Condoms are very important. We know that as young people, we are very active in terms, like when it comes to sex, we are always experimenting. That's the time where guys the kitchen and everything. And during that period, a lot of mistakes are made, a lot of wrong decisions are done. And we know that before you even think of anything, just condomize. Or anything else, you just deal with that after, but at least you are knowing that you are safe. You don't have HIV, you don't have STIs and everything. So I won't say much, just condomize.
Yeah, thanks so much, man, for your time.
Thank you so much.
Thank you. Let's talk about this day, M1. What does this day mean to you? Maybe tell us about your name first.
My name is Charlton Vimoyo. I work with Zimbabwe People Who Use Drugs Trust, and here I'm here to represent the people in our community to find out more about drug use, also in relation to condom use, which is why we're here today.
Talk to us about this day. What does this day mean to you as a programmer?
I find this day very important because we always get new cases of HIV being on the rise, STIs being on the rise. Sometimes they go down, but all of this boils down to usually how safe people are, and this goes to the way they use, methods they use to protect themselves. One of them being what we're celebrating today, condoms.
What can you say to young people at home who want about this day, about the importance of using condoms?
Condoms are very important. This cannot be overemphasized. Condoms are very important. We know it's very difficult sometimes when people going around with myths saying that, you know, it doesn't feel as sweet when you're wearing something, but that's not true. Continue to use condoms. They are very, very important. They can save your life.
You're programming around the issue of drugs and substance abuse. Talk to us about that, more about that in terms of Bulawayo.
Currently, Bulawayo has a situation where drug use is now on the rise, and it's being mainstreamed by the government, which is a good thing. And why my organization exists is to come and pitch in so that we can promote things like harm reduction. Harm reduction in this particular instance is they should not contract new HIV cases, even if you're a drug user. So one of the methods that we can help is using condoms.
Thanks so much, Steve, for your time this morning.
Thank you very much.
Maybe tell us your name and where you come from.
My name is Mrs. Sandra Sivanda. I'm born and bred in the Mashona land, but I've moved to Bulawayo. I'm now staying here at the moment.
Let's talk about the family planning that I've offered here, service that I've offered here. I see you've just put something here. Talk to us about that.
This thing here, it's called Jadel. There are 3 types of this family planning control. The first one, they say it's implant 1, implant 2, and this Jadel, it's for 5 years. Lasts for 5 years.
So are you happy with the service that are offered here? Did you pay anything? Is it for free? Are you happy about the service offered here?
I'm happy about the service that I was offered there, and it's for free. When I went to the clinic, I was supposed to pay $15, but they advised me that there's a outreach. So they advised me to come here, so I'm here, and they served me very well.
What can you say to other women out there who want to seek the same service but they can't afford? What can you say to them in brief?
I think what I can say to the women out there, I know life is tough these days. They should go to the clinic and explain their challenges, where they will be given advice on what to do. I think there are several family planning processes.
Today is International Condom Day. I like giving away free condoms to young people. What can you say to young people, in particular from Bulawayo, about the importance of using condoms?
It's good to abstain It's very good because you help yourself from the trouble of contracting many sexual diseases. But because people these days, due to different backgrounds, it's quite challenging.
Yeah.
But now we advise people to use their condoms so that we reduce the unwanted pregnancies and these viral diseases. Yes.
And thanks so much for your time this morning. Thank you so much.
And also I want to say, I think it's a good timing because tomorrow is Valentine's. You know, people have got this vibe of love. They don't understand.
Yeah.
They think sleeping with someone is love all the time, you know. So I think when we put this campaign, it's an awareness that helps people to remember that, you know what, they need to be able to protect themselves.
Thanks so much for your time.
Thank you.
Well, we've come to the end of the program today. We're broadcasting out of the studio right in Amara, where different stakeholders are showcasing different services that they offer there to young people and also to the elderly. Remember, there was a free condom distribution and different free services, HIV testing, STIs testing, cancer screening. Different stakeholders came on board to showcase what they're offering to different people out here in Bulawayo. I hope you guys enjoy the show and happy World Condom Day. From myself, Brighton Ngube, it's bye for now.